Welcome to a Bike Fitness Coaching exclusive presentation on knee biomechanics and crank length, featuring Rick Schultz and Sue Schultz of Bike Fitness Coaching. Lately, we've seen lots of great videos on YouTube discussing shorter cranks. They mention advantages such as the rider can become more aero, they are more comfortable, and no power loss. But none of these videos get into the anatomy, kinesiology, and biomechanics as to why shorter cranks are better than longer cranks. The traditional viewpoint was the longer the lever arm, i.e. the crank arm, the more force or torque I can apply to the pedals and ultimately the rear wheel. So the pros went with 175s, 177.5s, 180s, 185s. And how did these work out? A lot of those World Tour pros retired before 30 years old with blown out knees. In this presentation, we will discuss the whys. Going forward, I believe we should call these right-size cranks versus short cranks. Basically, what is the actual definition of a short crank? The answer is any size shorter than standard. The standard used to be 175, so a short crank was 172.5. Then 172.5 was the standard, so a short crank was 170 and shorter. Now 170 seems to be the standard, so a short crank is 167.5, or is it 165 and shorter? Recently, some pro cyclists started using 165 cranks, and now Shimano and SRAM are now making 160 cranks. Is 160 now the shortness standard? This presentation will be divided into two parts. In this presentation, we will focus on knee biomechanics and the role that crank length plays contributing to knee damage in cyclists. When we compare crank lengths ranging from 175 to 135 millimeters, it is striking that the difference between 175 and 165 and between 165 and 155 does not seem as large as most riders think. When you pedal a bicycle, you are using what engineering defines as a 4-bar linkage. So small change in crank length equals a large change in knee flexion. In our experience, bicycle manufacturers build their bikes with crank arms that are too long for most riders. The second point I want to make is that let's call these right-size cranks instead of short cranks.
Before discussing knee biomechanics, it's useful to define some of the terms we use to describe knee anatomy. The first term is tendon. Tendon is a piece of tissue that connects muscle to bone. A ligament is also tissue that connects bone to bone and is used to stabilize joints. Movement of the knee is described by extension, which is when the quadriceps contract to extend the knee and push the pedal forward and downward. Flexion, on the other hand, is induced by hamstrings contracting to flex the knee and pull the pedal upward. Cartilage is a type of connective tissue that is more flexible than bone. It provides cushioning, shock absorption, and support to joints and other structures in the body. Articular cartilage allows low friction sliding of the patella on the patellofemoral head. Fibrocartilage is a specific type of cartilage that is tough and strong due to its high collagen content. Heavy-duty versions of cartilage, making it well suited to withstand compressive forces. An example of a fibrocartilage is the meniscus of the knee. Agonist is a muscle that contracts to produce a particular motion. It is also known as the prime mover. An antagonist is a muscle with the opposite action of the primary mover. Impingement. We'll be talking about this term a lot as bike fitters, but impingement is a condition where bone or tissue in the body rubs against another bone or tissue, causing irritation and pain and limitation of movement. Abductors. Abductors are muscles that draw a body part away from the midline of the body. Adductors, on the other hand, are muscles that draw a body part towards the midline of the body. Range of motion. The extent or limit to which a part of the body can be moved around a joint or a fixed point. It is the angle through which the joint moves from the anatomical position to the extreme limit of its motion in a particular direction. Range of motion is used often to measure joint functionality and flexibility. Bones are rigid organs that form part of the endoskeleton of vertebrates. They support and protect the various organs of the body, produce red and white blood cells, store minerals, provide structure and support for movement, and are important to enable movement. Finally, muscles, we've talked about, are contractile tissues that produce force and motion to move the body or its parts. They maintain posture, circulate blood, and perform vital functions like excitability, extensibility, elasticity, movement, posture, heat production, protection, energy storage, and contractility.
To understand how the knee moves when riding a bicycle and how knee injury can be prevented when riding, it is important to understand how the human body interacts with a bicycle, a field of study referred to as biomechanics. Many riders believe that they can adapt to most bike geometries. Unfortunately, this is often not the case. As a bike fitter, I often get the question, what bike should I get? My answer is there's a lot of good bikes out there. It's best to get one whose geometry best fits your anatomy. The physical attributes of riders can vary significantly and play a critical role in determining whether a rider can adapt to specific bike geometries. For example, riders can have long legs and short arms or torso, or short legs and long arms or torso. Which one of these riders would best fit on, for example, a Trek Madone, which has a long reach and a short stack? There are many adjustments you can make to fit a rider, like replacing the stem with a shorter stem or a longer stem, but these changes can adversely affect the bike's handling characteristics. A cyclist's body will adapt until it can't adapt anymore. For many riders, it is possible to ride for some time without pain. The damage resulting from riding a poorly fit bicycle is often gradual and not noticed by riders. The damage that occurs often accumulates slowly, like filling a glass with water, one drop of water after each ride. Nothing happens until that last drop of water causes it to overflow. The body adapts until it can't adapt anymore. Once this point is reached, it is often very difficult for the rider to undo the damage without seeing an orthopedic surgeon. There are many bike fitters on social media whose advice is superficial at best and can be quite harmful. For example, a question often asked is, how do I get relief at the top of the pedal stroke? The answer usually is just raise the saddle. Well, the next question should be, what happens if you raise the saddle to the point where the cyclist can't reach the pedals anymore and they still need the saddle higher? This AI-generated picture is an exaggeration of the lower body, leg and knee, and shows that the mighty quadriceps basically all tie into the quadricep tendon, which, when the quads are flexed, will extend the lower leg. The longer the crank arm, the more flexion, higher forces, both shear and compressive, at the top of the pedal stroke, and the more potential damage to the knees. Most of this damage can be mitigated with right-sized cranks. In the past, riders and manufacturers spec their components based on mechanics and not biomechanics. While related to each other, the field of mechanics and biomechanics are not the same. Mechanics is the branch of physics concerned with the behavior of physical bodies when subjected to forces or displacements and the subsequent effects of the bodies on their environment. Mechanics is a broad field encompassing the study of motion, forces, energy, and equilibrium. Biomechanics, on the other hand, is the application of mechanical principles to living organisms, particularly the human body and animals. It studies the structure, function, and motion of biological systems using the laws of mechanics. Biomechanics focuses specifically on living systems and how they interact with their environment, including human movement, muscle mechanics, skeleton mechanics, cardiovascular mechanics, and tissue mechanics. The summary is biomechanics is a specialized application of mechanic principles to the study of living organisms and has more limitations regarding movement than mechanics does. Now we're getting to the slides that discuss the knee specifically. In this simplified diagram of the basic structures that are involving in controlling of the knee joint, pay particular attention to the way the patella works, the tibia, the quadriceps, the lateral view of the knee. Here is the femur, tibia, patella, and here's the quadriceps tying into the quadricep tendon, which pulls on the patella, which pulls on the tibia via the tibial tuberosity to extend the knee. Here's a quick example of how the knee works. Here's the femur, the tibia, tibial tuberosity. Here is the quadricep tendon, patella tendon. Here is the patella. And on the inside, you have the articular cartilage that the patella glides on. So at the top of the pedal stroke, the quadriceps will flex and pull the knee, extend the knee as a knee extensor. The problem is, this is locked in, and you pull here. This patella tendon, quadricep tendon, does not stretch much. So imagine if I'm at top pedal stroke, all of that force, if I'm not moving this or I'm pulling this upwards, all that force is directly tied and directly forced right into the patella, abrading away the inside of the patella and the patella articular cartilage on the patellofemoral head. And that constant grinding is what causes the knee pain. Excessive angles, excessive shear and compressive forces, which we will discuss in a few minutes. Pedaling a bicycle does not just involve the knee joint, it involves major muscle groups as well. Key muscle groups and their roles in pedaling. Cycling, despite its seemingly simple motion, is a complex interplay of muscle activation in the legs. Different muscles contribute to different phases of the pedal stroke. Understanding this pattern can help cyclists optimize their pedaling technique. The key muscle groups and their roles are gluteus maximus, or the buttocks, a major power producer during the downstroke approximately 1 o'clock to 5 o'clock. It extends the hip, driving the pedal downward with force. The quadriceps comprise of 4 muscle groups. These muscles extend the knee, contributing significantly to the power phase of the downstroke, approximately 1 o'clock to 5 o'clock. They work in conjunction with the glutes to propel the bicycle forward. The rectus femoris, being a 2-joint muscle crossing both hip and knee, also assists with hip flexion. Hamstrings comprise primarily of the bicep femoris. The hamstrings have multiple roles throughout the pedal stroke. They mainly contribute to knee flexion during the bottom of the stroke and into the pull-through phase, approximately 6 o'clock to 9 o'clock. They also stabilize the knee joint. The calf muscles, gastrocnemius, assists in plantar flexion of the ankle during the bottom of the stroke and into the pushover phase, approximately 6 o'clock to 9 o'clock as well, helping to maintain contact with the pedal and contribute to force production. The soleus, being a 1-joint muscle crossing only the ankle, is primarily involved in plantar flexion and stabilization. The tibialis anterior, or shin muscle, dorsiflexes the ankle, which means it lifts the toes. It's active during the recovery phase, approximately 9 o'clock to 12 o'clock, to prepare the foot for the next downstroke and prevent the foot from dragging. The hip flexors, or iliopsoas, these muscles primarily initiate the upward pull through the recovery phase of the pedal stroke, approximately 10 o'clock to 12 o'clock. They lift the leg and prepare it for the next power phase. The rectus femoris also contributes to knee extension. A recent conversation with Chris Horner said, yes, the pros do pull up. during the upstroke of the pedal stroke. In the next 3 slides, we will discuss knee extension, knee flexion, and hip flexion. Extension of the knee is controlled by a specific set of muscles, mainly the quadriceps, whose activation drives the power phase or downstroke of the pedal. The quadriceps are a very powerful muscle group and essentially terminate at the knee, the quadricep tendon, which means that most of their force is concentrated at the patella. To flex or contract the lower leg, the knee flexors come into play, primarily around 5 o'clock to about 9 o'clock. These are primarily the hamstrings, but 5 other muscle groups also assist in flexing the knee and helping the leg to get up and over the top of the pedal stroke. So how do we get to the top and over the top of the pedal stroke? To bring the knee to the top of the pedal stroke, the hip flexors come into play. These are primarily the psoas, PSOAS, major and minor, and primarily around 9 o'clock-ish to 12 o'clock.
We have briefly discussed the complexity of the knee joint. So why is it one of the most injured joints in cyclists? The list on this slide indicates there are several factors that contribute to the possibility of knee injury, and we're going to go over each one of these. The first is repetitive motion. During a 2-hour bike ride at 85 revolutions per minute, the cyclist will do 10,200 pedal revolutions. So cycling involves thousands of repetitions of the same movement, knee flexion and knee extension, over long periods of time. This repetitive strain can lead to overuse injuries, especially if the bike fit for that cyclist is incorrect or if there are underlying biomechanical issues. A second factor is high forces. Cycling is a high force, low impact exercise. While cycling is generally considered low impact, the forces that are generated through the knee joint can be quite high, particularly during climbing or sprinting. Each pedal stroke puts stress on the cartilage, ligaments, tendons, and muscles surrounding the knee. Cycling and pedaling is a fixed movement pattern. It's highly constrained movement where the foot is locked into the pedal and the knee follows a relatively fixed path. This limits the knee's ability to adapt to variations in terrain or fatigue, making it more vulnerable if something is slightly off. Poor bike fits certainly contribute to knee injury. An incorrect bike fit is a major contributor to knee pain in cyclists. Common issues include improper saddle height. A saddle that is too low forces the knee to bend excessively, increasing stress on the patellofemoral joint, which is the joint between the kneecap and the thigh bone. A saddle that is too high can lead to overextension of the knee and strain on the hamstrings. The fore-aft position of the saddle. If the saddle is too far forward or backward, it can alter the angle of the knee relative to the pedal axle, leading to increased stress. Cleat position. Cleat position is often given a secondary thought. It's very, very important. So improper cleat positioning can force the foot and knee into unnatural positions, leading to misalignment and pain during pedaling. And finally, handlebar reach. A reach that is too long or too short can affect posture and put strain on the knees. Another factor that can contribute to knee injury is muscle imbalances. Weaknesses or tightness in certain muscle groups can contribute to knee problems. For example, if you have a weak or tight quadricep, this can lead to patellofemoral pain. If you have weak or tight hamstrings, these can limit knee extension and contribute to posterior knee pain. Finally, weak gluteal muscles can cause the knee to rotate inward, increasing stress on the joint. Underlying biomechanical issues can certainly contribute to knee pain. These could be pre-existing conditions like overpronation, which is excessive inward rolling of the foot. You could have a leg length discrepancy, which is unequal leg lengths. Or you could have misalignment of the hip or ankle. These can alter the mechanics of the knee and increase the risk of injury. Another problem can be rapid increases in training volume or intensity. Too much, too soon is a common cause of overuse injuries. Sudden increases in mileage, hill work, or intensity can overload the knee joint. Gear selection is very important. Riding in too high a gear or grinding puts more force through the knee joint with each pedal stroke, increasing stress. And finally, lack of cross-training. Not engaging in other activities to strengthen and stabilize the muscles around the knee can increase knee vulnerability to injury.
In cycling, compressive forces on the knee joint are generally higher than shear forces, although both are present and can be influenced by factors such as saddle height and position. Here's a more detailed breakdown. Compressive forces. Cycling, especially at higher workloads, generates significant compressive forces on the knee joint, particularly the tibiofemoral joint between the tibia and femur. These forces are influenced by factors like saddle height, pedal rate, crank length, and workload. Studies show that compressive forces are generally higher than shear forces. For example, tibiofemoral compressive forces during cycling are between 0.3 and 2 times the body weight, while walking, stair climbing generate forces of approximately 2 to 4 times body weight. Shear forces, which act parallel to a surface, are also present in cycling. We are concerned about the shear forces against the patella against the articular cartilage. Factors influencing forces are saddle height, saddle position, workload, and crank length.
Let's take a look at factors that affect compressive forces during pedaling. Reminder that the compressive forces on the knee during normal walking can range from 1 to 2 times your body weight, and they significantly increase during activities like stair climbing, which is up to 3 times your body weight, and running, which can reach 3 to 4 times your body weight. The highest forces experienced at the patellofemoral joint or kneecap occur during deep knee flexion. So, what are some of the factors that affect compressive forces? Well, we've already mentioned the impact of activity. So the force on your knee increases significantly with more strenuous activities like running, jumping, deep squatting, and cycling. And cycling with saddles too low or crank arms too long definitely impact the compressive forces on the knee. Other factors that affect the compressive forces at the patellofemoral joint are that this joint, where the kneecap meets the femur, experiences the highest compressive forces due to the action of the quadriceps muscle, which extends the quadriceps tendon, forcing the patella into the patellofemoral head. Another factor that's important in terms of compressive forces is your body weight. A person's body weight directly impacts the compressive force on their knees, with heavier individuals experiencing greater forces. Interestingly, the strength of the quadriceps is also a factor. So strong quadriceps can exert higher forces on the tendons that allow the patella to grind into and abrade the articular cartilage. Finally, the meniscus. The menisci in the knee joint act as shock absorbers, helping to distribute compressive forces and protect the cartilage. The higher the vector forces on the patellofemoral head, the higher the compression and grinding forces on the menisci. And these potentially can cause vertical tears at the horns of the menisci. This, in turn, can affect the cartilage and subchondral bone.
In the next two slides, we will discuss shear and compressive forces. In this slide, shear forces in the knee refer to forces acting parallel to the joint surface, attempting to slide one bone, the tibia, across the other, the femur, and primarily impacting the knee ligaments, with the main types being anterior shear forces pulling the tibia forward and posterior shear forces pulling the tibia backward, which primarily affect the ACL and PCL respectively. Excessive shear forces can lead to knee injuries. Factors affecting shear forces: knee flexion angle, which is the amount of shear force increases with greater knee flexion, i.e. saddle too low and or the cranks too long. Muscle imbalances: unequal strength between quadriceps and hamstrings can lead to excessive shear forces as well. And alignment issues: improper leg alignment can also contribute to shear forces on the knee. Factors influencing knee stress in cycling. Saddle height: too low, excessive knee flexion; too high, overextension, pain in the back of the knee. Saddle foreaft impacts knee position relative to the pedal spindle. Cleat position affects foot alignment and knee tracking. Crank length, a major factor we'll discuss later. Gear ratio: high resistance equals more force on the knees. Cadence: low cadence equals higher forces on the knees. Pedal spring tension: high twisting force on the knees when unclipping. Common knee pains in cycling: PFPS, also known as cyclist knee, pain around or behind the kneecap, often exacerbated by hills, high gears, or prolonged sitting, caused by poor tracking of the patella in the femoral groove, but mainly from crank arms that are too long. IT band syndrome: pain on the outside of the knee where the IT band rubs against the lateral femoral epicondyle, often caused by tight IT band, improper bike fit, or weak hip abductors, abductors. Patellar tendonitis: pain at the patella tendon caused by overuse and repetitive strain. Tendonitis, bursitis, pain on the inside of the knee can be caused by overuse, improper bike fit, or tight hamstrings. MCL strain or sprain, less common, normally caused by trauma. That is also pain on the inside of the knee. Meniscus tear, a tear in one of the cartilage discs in the knee, can be aggravated by cycling, particularly with poor bike fit and high shear and compressive forces. And osteoarthritis, degeneration of the joint cartilage. Cycling can exacerbate the symptoms. 7 articles on topic, which we will link in the description. This is the end of part 1. We hope you liked it, and we are getting ready for part 2.